Good morning. I am Chief Maggie DeBoer, President of the Virginia Association of Chiefs of Police. We are here today alongside many of our partners from the mental health community to call attention to the immediate crisis before us involving the lack of both inpatient psychiatric bed space as well as community-based resources for mental health services affecting every community within the Commonwealth of Virginia. Standing in solidarity for attention to this is our Executive Director, Ms. Dana Shroud, and our VACP board members, Chief Pennebieko from Middleburg, Chief Jeff Katz of Chesterfield County, who is on his way, Chief John Clare from Marion, Chief Cameron Abzal from Hopewell, and Chief Scott Booth from Danville. Also with us is one of our past presidents, Doug Goodman from Ashland, as well as Major Todd Alvis from Henrico. I appreciate all of you attending today. Not able to make the trip today are our VACP board members, Chief Hall, Chief Hartman, and Chief Branch, who are also very passionate about the issue that's before us. Also with us today are Jennifer Faison, Executive Director of the Virginia Association of Community Services Boards, Bruce Cruiser, Executive Director, Mental Health America of Virginia, and Janet Arison of the Virginia Municipal League. I want to start by thanking the town of Ashland and Police Chief Doug Goodman, a past president, as I mentioned before, allowing us to use their home base today to bring awareness to this important issue within the Commonwealth. When I looked around with my fellow chiefs and Major Alvis that's here today, and certainly with Jeff Katz on the way, there is over 225 years of law enforcement experience in this room. So we certainly can tell you that what we know today is that the mental health system in Virginia is clearly broken. We've seen the slow degradation of available resources in the state over time, and what we have also seen is the need for mental health resources has continued to grow. And the pandemic has only exacerbated this need at a time when that face-to-face treatment was not possible for many people. It's interesting because I was telling my public information specialist on the way down here that when I first started this job 35 years ago, my very, very first call as a rookie officer when I was in a training period was a mental health call. And it involved a senior citizen, an elderly senior citizen female who was having a schizophrenic episode and was armed with a butcher knife. Very first call I went on as an officer. And without the less lethal tools and options that we have today, we were very lucky to have resolved that issue with no injury to anyone. But when I started thinking about that, and when I think about the process that was involved in taking custody of that person in an emergency order, of getting them to an emergency room, of sitting waiting for them to be medically cleared, how they were processed, where they were transported, nothing has changed about that system in 35 years. And when you think about police reform and you think about how we do business and technology and laws and policies and procedures, all of that has changed radically in our profession in 35 years, all of it. And every chief and the major standing up here can say that. But the process and how we deal with mental health has not changed. As a matter of fact, those wait times are longer. It takes longer to get somebody processed. The transport takes longer to get somebody to a bed. The availability is less available. And there are significantly more people in need now than there were 35 years ago. That tells you how broken our system is. As our law enforcement leaders, we stand here in partnership with many that support our health systems around the state. And you may be asking, why now? Why are we standing together now? Because we all know, all of us standing up here and sitting before me, we all know this is not a new issue. It's been slowly crumbling over many decades in the making, and it's an issue that our partners and ourselves have repeatedly sounded the alarm bells for, tried to draw attention. But the mental health community does not have a loud lobby. They do not have a loud voice, but they affect everything that we deal with in our community. They affect the addiction rates, they affect the quality of life issues in communities, they affect personal health and mental wellness, they affect everything. Yet it's never ever received the attention that it truly deserves. And it knows no barriers. It's not a quick fix. Certainly, the issue didn't happen over time, so the fix is not going to be quick. And just as this issue took time to collapse, it's going to take a significant amount of time to rebuild. But we have to make that commitment now, not only to rebuild these programs and services, but change the way, literally change the way we approach assisting those who need mental health resources. The time is now, absolutely now, to start planning strategically to create a sustainable, community-based mental health services so fewer people end up in crisis and need beds, and so that they can be treated without being transported away from the support of their family and loved ones. This issue is not about law enforcement, although we are continually being called on to intervene when there are no other options. In the middle of the night, who do you call in government when you need help? No matter what your issue is, you call law enforcement. And this is happening at a time when our General Assembly, the public, and our profession, our own profession, want to reduce our role in handling mental health calls. Yet we're continually called upon to do more. Although the Marcus Alert legislation is a good first step toward a more effective co-response model, and we all support that, it does nothing to increase bed space in our psychiatric facilities or provide alternate resources at the local level to help people get help before they come in crisis, before they need a law enforcement intervention or a crisis counselor in the field. The issue truly is about the communities we serve, not about us. From a government services standpoint, we see firsthand, all of us have seen this and experienced this, the impact that mental health is having on our communities. Just last week in my own community, we saw some significant incidents that had a mental health nexus attached to them. This problem is continuing to grow, and law enforcement officers are always working and available, and they are who we call when there's nowhere else to turn. We routinely have contact with people who need mental health services but lack the local resources to refer them to. If they're not in crisis and they ask for help, we don't know where to send them. We don't have an ability to hook them up with somebody to get help. The resources are just not there. And the ones that are there, they're so scarce, they're rarely available for people to access. We repeatedly end up in contact with those who can't find help or refuse to get help. And ultimately, the lack of community-based resources can often lead to involvement in the criminal justice system instead of mental health facilities that may lead to a more appropriate and positive intervention. Criminalizing mental health illness can never be an acceptable answer. I would like to ask Jennifer Faison, Executive Director of Virginia Association of Community Services Boards, to offer her remarks at this time.
Good morning. My name is Jennifer Faison, that's Faison, and I'm the Executive Director of the Virginia Association of Community Services Boards. I am here today on behalf of Virginia's 40 community services boards, which are the publicly funded organizations that make up the safety net for behavioral health and developmental disability services. And I'm in very fine company this morning with a variety of our stakeholder partners gathered, all in support of the same goals. The VACSB asks our policymakers, including the governor and the General Assembly, to put all of us first. What I mean by that is I'm asking to put the entire public system first, which includes the CSBs as well as the state hospitals. And this also means putting the needs of individuals served in this system first. Putting all of us first means that for every dollar the governor and the General Assembly decides to invest in the state hospitals, an equal investment needs to be made in community-based care. We cannot continue with our cognitive bias towards zero-sum thinking, where one side of the system gains only when the other side of the system loses. Mutual gain should be the goal, if indeed we want to benefit the individuals that we serve. We completely understand the pressures created by a lack of staff at state hospitals, and we understand the risks associated with operating in that environment. Many CSBs operate 24/7 residential programs serving individuals with significant behavioral health challenges, just like our state hospitals do. However, closing state hospitals to admissions simply shifts those risks from the hospitals to the community, and it does not solve the underlying problems. We are in a position right now in Virginia where we have to sustain and keep safe the system that we have. And at the same time, we have to build and invest in the system that we all want in Virginia. It will be expensive, no doubt, but the people with behavioral health and developmental disability service needs in the Commonwealth deserve nothing less than our best effort. There is an unprecedented opportunity right now with the billions of dollars in federal funding that are coming to Virginia to assist the community with the significant workforce challenges using a similar strategy of investments as those currently being contemplated to assist state facilities with their workforce shortages. This includes recruitment and retention bonuses, scholarships, student loan repayments, and other options. Our private providers need our support as well, but we are here to bring your focus and your attention on the public system for safety net care for individuals with behavioral health and developmental disability service needs. The VACSB's full proposal for the use of those federal ARPA dollars is available on the VACSB website, but we cannot stop there. Our system is in need of ongoing and sustained investments using state general funds in order to fully realize the statewide goals that have been identified and to begin to move us to a system that works well for the people of Virginia and truly puts all of us first. Thank you for listening.
Our next speaker is Bruce Cruiser, Executive Director for Mental Health America of Virginia.
Yes, thank you. Good morning. As she said, my name is Bruce Cruiser. I'm Executive Director of Mental Health America of Virginia. Since our founding in 1937, the Mental Health Association, as it was known then, has worked to improve state hospital conditions, to increase public awareness of mental health, and to establish community mental health services. Now, for several years, Virginia has ranked around 41st in the country in access to a trained mental health workforce. For several decades, Virginia has underfunded mental health services and over-relied on hospitals at the expense of care in the community. Now, the pandemic's impact on mental health of Virginians has brought an already stressed system to a crisis point. The result has been systemic failures, with frightening results for some individuals and families living with a mental illness. Adults and children in crisis are waiting indefinitely in emergency rooms for a treatment facility. Local jails hold many whose incarceration could have been prevented with access to appropriate services. This is not the way we should treat someone with a serious illness. State hospitals must be safe at all times for all patients and staff, and be equipped to provide the best opportunities for patients needing long-term care. At the same time, a permanent solution to the current bed crisis requires a diverse and equitable system of community care in all corners of the state. We have an opportunity now to transform the system. Use federal funds and recurring state funds to provide hospitals what they need to be fully staffed and safe, to provide our community services boards what they need to deliver services that prevent a need for hospitalization. Provide incentives for more types of mental health services to meet the needs of those in underserved communities. Increase Medicaid payments to treat mental illness at least equal to the rates for treating substance abuse. And build out crisis stabilization services closer to home that prevent many individuals from needing hospital care. This also means law enforcement would spend fewer hours transporting those in crisis to hospitals across the state. It's less expensive, with less trauma for children and adults. So what can the public do right now? Well, first, get help before things reach a crisis point. Treat mental health as part of everyone's overall health. If you or a loved one are not well, talk about it with someone you trust to be supported. Make an appointment with a mental health service provider. There may be a long waiting list, but the sooner you make those contacts, the sooner you will feel better. You may also contact our Pure Run Warm line at 866-400-6428. If we address hospital care, in concert with the range of private and public mental health services, we can solve the crisis in our mental health system. Thank you.
Our next speaker is Janet Arison on behalf of the Virginia Municipal League.
Good morning. I'm Janet Arison. I work with the Virginia Municipal League, which is a nonpartisan, nonprofit association founded in 1905. And our members are Virginia's cities, our towns, and select counties across the Commonwealth. And I'm here in support of our partners here today and the stories that they have to tell about what's going on in the community system, and just want to pledge our support to them and to the solutions that they are putting forward to forwarding our system and having better outcomes for all. Thank you.
Thank you, Janet. Our effort today is also the support of the Virginia Association of Counties, VACO, who couldn't be with us, and the Virginia chapter of NAMI, the National Alliance on Mental Illness. The members of the VEC Executive Board represent communities and agencies, both large and small, from across the Commonwealth. One area of the state severely affected by the lack of local mental health services is Southwest Virginia. And we thought it would be really important for you to hear specifically about the challenges that they are dealing with there. Today, to discuss that with you, I'd like to recognize Marion Police Chief John Clare.
Thank you, Maggie. That's John Clare, C-L-A-I-R, Chief of Police of the town of Marion, and we're located in Southwest Virginia. I wanted to come today to talk about the unique challenges that we face in rural and Appalachian parts of the Commonwealth. The people of Southwest Virginia need the General Assembly to understand that rural infrastructure cannot absorb mental health failures. These service needs are not evenly distributed across the Commonwealth. They're particularly acute in rural areas, still stretched incredibly thin by the generational damage of the opioid epidemic. Our law enforcement agencies do not have the surge capacity of more populated areas. Our CSBs do not have the surge capacity to deal with system slowdowns. Our healthcare systems do not have the surge capacity for patients to wait 40, 50, 60 hours in hospitals. One thing that we do have is a statistically significant and demonstrable need for expedient, high-quality mental health services. And these struggles are well documented. In rural areas, the geography alone can be the most challenging aspect of service delivery. And this only becomes compounded when avenues for placement are taken away from us. Law enforcement has been sounding this alarm for the last year. A year where the General Assembly spent their time worried about how many marijuana plants somebody can have, or how many taillights need to be out before the police can stop you. I want the General Assembly to focus on this issue with tangible solutions. We continue, as Chief DeBoard said, to get thrust into these scenarios when we're under increased scrutiny for them, and that's a difficult thing for us to do. But we're the ones who have been sounding the alarm for the last year, asking for solutions. Our legislators cannot have it both ways. Stop putting us in this situation, stop putting patients in the situation, stop putting CSBs in the situation. No amount of training or ideology is going to fix this, and I really appreciated what Ms. Faison said, and I think it's easy to gloss over. What she said is it's nice to have good ideas for the future, but we need solutions right now as well. If you were the manager of a small city and you woke up one day and it was flooded, are you going to go around telling people how you're re-engineering the dam? Or are you going to get them off the rooftop? That's what we need the General Assembly to do. The system is broken. It was authored by legislators, and we need legislative and financial fixes. Thank you.
I'm going to wrap up here in a minute, but I would like all of our chiefs and certainly Major Doug, if you could come up here and just stand with me for a minute, please. I'd like all of our law enforcement leaders up here. I think this is very important for the message that we're trying to send along with our mental health partners. There could be no stronger need in the Commonwealth now to be addressed than mental health. John said it very well, Chief Clare said this very well. It is going to take a legislative fix, but it cannot be a quick fix. And this is the challenge that I'm going to put forth to our legislators. When you have to deal with something that's not a quick fix, and you have to put strategic planning in place, you have to do that with the understanding, just like we do as police leaders when we're developing people to take our place one day, that you may not be around to see the fruits of what you sow, to see the seeds of what you sow. You have to be willing to put the effort and the work in now to address this issue systematically, even if you may not be in office or you may not be in your seat down the road. The community deserves that. That's why we have elections. That's why we put you in place. That's why we are appointed in the position to do things for our community, even long after we are gone from our leadership roles. And I urge our General Assembly and our governor to do the same thing, to take that same approach to the mental health issue. It's really important. So what we have coming forward to us is we have a special session that starts on August 2nd, and we know that we cannot solve these problems in that short period of time. But as Jennifer alluded to, and Bruce and others, there is money available that should be put quickly and directly toward making beds available and space available to get people into treatment that need it now. And then the next step of that would be into January to work closely with our partners up here. And we have not stood with our partners before, but that's how important this issue is publicly for us to stand with them, is to work with our partners and with our legislators to develop those long-term strategic solutions to get those, and also our faith-based community, because we talked a lot with those folks as well, to get those resources dedicated and pushed down to the local level, which will minimize our interactions, but more importantly, get people the help in their communities before they rise to a level of crisis. So we urge our General Assembly to take those steps to work with us closely, and this has to be an ongoing process moving forward. So with that, I will wrap up this press conference as far as our formal remarks, and I offer that we will take questions, any of us up here, including any of the chiefs and law enforcement leaders and partners that are here, for questions that you may have.
I would ask if you could maybe if one of you could give an example of what it is like to have a situation where an encounter with someone in a mental health crisis, and then the process to get them somewhere. How long are we talking about?
Yeah, sure.
Go ahead.
And I'll say that my examples are not the longest, but in Marion, we had a 50-hour-long event. So we find someone, consider this for a moment, we find someone who's experiencing a crisis. We recognize that, and we want to get them help. So we transport them to a local hospital, which becomes the place where they meet a pre-screener who determines, yes, this person is in crisis. They need help. They need treatment. And then they wait 10, 20, 30, 40, 50 hours to receive that treatment. They wait almost as long as the code authorizes their stay in the hospital. By that time, they're more than likely okay, and we're the ones in crisis. We've been there so long. That's the kind of frustration that we go through. Not only that, we're assaulted. We've had incidents in Marion where we've been assaulted. We've taken this person to the magistrate to attend, they've committed a crime at this point, and they're returned back to the hospital. Our hospitals, the other night I was told that the Smith County Hospital, which has, I think, 10 or 12 available beds, 6 of them were full of mental health patients. We don't have the capacity for it. And the time is not helping anyone. Forget about bed space, forget about all that. Think about if you actually had a crisis. Really, and maybe you're not someone prone to these things, and you actually have it, and you reach out for help, and 50 hours later, you're still waiting.
In handcuffs.
In handcuffs, in police custody. We're not therapists. We're going to do the best that we can, but we can't offer anything real. And then we probably have to drive you a couple hundred miles to get you where you're going to finally get the help that you need. It's disgusting.